physicians are the quarterback. They are the captains of our team. We all understand that.
Welcome to Off the Chart with Medical Economics, a podcast featuring lively and informative conversations with healthcare experts, opinion leaders, and practicing physicians about the challenges facing doctors and medical practices. I'm your host, Keith Reynolds, and today we feature an interview between Medical Economics Editor Richard Payerchin and U.S. Representative Earl L. Buddy Carter. He's a Republican from Georgia, a career pharmacist, and small business owner of Carter's Pharmacy of South Georgia. They discuss the Affordable Care Act, Medicare, and why it's important for physicians to get involved in policy decisions.
I'm Richard Payerchin, reporting for Medical Economics. With me today is Representative Buddy Carter. He's a career pharmacist who now represents the state of Georgia. Congressman Carter, thank you for joining us today.
Well, thank you for having me.
You're a sponsor of the Telehealth Modernization Act of 2024. Can you explain what would that bill do? And in your own words, can you discuss why telehealth is so important?
Well, first of all, as we went through the pandemic, I think that one of the things that we witnessed is that the proliferation and the importance of telemedicine and telehealth and how it has now become an integral part of our healthcare system. And that's very important. And what this Modernization Act does is to simply extend the flexibilities for 2 more years. I wanted to make it permanent. I had to kind of compromise on that. So we want to make it for 2 more years. And I think we're going to be able to do that, but it will be important. Look, there was a headline in one of the national papers that said that telehealth had advanced more in a month than it had in the last 10 years during the pandemic. And I think that's true, as I say. And now it's become, as I said before, an integral part of our healthcare system, particularly in the rural areas where, access. I mean, look, whether you're a Republican or a Democrat or an independent, we all want the same thing in healthcare, and that is accessible, affordable, quality healthcare. Accessibility is extremely important, not only because of the distances we have to travel. One thing we have to keep in mind now, and this is one of the advantages of telehealth, is that we're having trouble attracting physicians anymore. And particularly in certain specialties, particularly in psychiatry and in primary health, and all of that is important. This gives the opportunity, particularly for those in rural areas, again, to have access to those specialists and to those physicians.
The Health Subcommittee of the Energy and Commerce Committee had 23 different items of legislation to consider and mark up. What are some of the bills that primary care physicians should be paying attention to?
Well, I actually had a couple of bills in that. We had one was, of course, dealing with telehealth. We had a number of them that were dealt with PBM reforms. In fact, one of the PBM reforms is the Protecting Patients from PBM Abuses Act. And what this does, we all know about the vertical integration that exists now, particularly in the drug pricing chain, where you have the insurance company that owns the PBM, that owns the group purchasing organization, that owns the pharmacy, that in many cases owns the doctor and employs the doctor. And that vertical integration has led to an increase in prescription drug prices. Well, one of the things that this will do is that this will de-link the compensation of the PBM from the drug, and instead it will from a percentage of the drug, I should say, and instead it will just be a flat fee. What we find is that so many of these PBMs are getting discounts from manufacturers that are not being passed on to the patient. This will eliminate that and make sure that these PBMs can't profit from these negotiated rates that they're getting.
And that's a perfect segue into another question I wanted to ask about. As a pharmacist, can you discuss your experience with pharmacy benefit managers? And I guess what other provisions or rules would you like to see for them?
Well, I can. I will tell you that they haven't been good ones. They haven't been good experiences. Look, I'm not opposed to capitalism. I get it. We live in a capitalistic society, and I'm not opposed to people making money. Look, I owned my own pharmacy for 32 years. Yes, I wanted to service patients, but I also wanted to make a living as well. And there's nothing wrong with that. However, as I mentioned before, what has happened is that PBMs have evolved into something they were never intended to be. When they started out, all they were just processors. They just processed claims. That's all they did. Well, you get into the situation that where hospitals have formularies, drugs, manufacturers try to get their drug on the formulary. PBM started controlling the formularies, and in order to control the formulary at a hospital or in the insurance especially, then they were negotiating discounts from the pharmaceutical manufacturers to be included on their formularies. And again, they're not being passed on to the patients or to the plan sponsors. Now, they may tell you, well, we pass them on as decreased insurance, or that's the way we keep our premiums down. Well, I don't know about you, but my premiums haven't gone down. And that's just simply not happening. If the discounts were being given at the point of sale, and if they were going to the patient or to the plan sponsor, I wouldn't have any problem with that. But that's not what's happening. And it's a result of the vertical integration, as I mentioned before, that exists now. And that's why we really need to bust it up, in my opinion. And it's not just in prescription drug pricing. It's also, whereas I appreciate the healthcare systems, I appreciate the hospitals, look at them. They're giant corporations now. And that just does not lead to competition and to lower prices. And I think that's a big problem. Look, I appreciate them being there. I appreciate the services that they offer. But, we need to talk about the fact that healthcare costs are out of control, particularly prescription drug costs. How do I know this? I know this because I was the one who had to go to the counter and tell the senior citizen how much the price of their drug was and watch them make a decision between buying their medicine and buying their groceries. I was the one who had to go to the counter and tell the mother how much her antibiotic for her child was going to be and watch her in tears as she tried to figure out how she was going to pay for it. When I came to Congress 10 years ago, I said as my goal and as my focus to do something about that. And that's what I've been trying to do.
I'm going to change gears just ever so slightly. Historically, medical economics has served primary care physicians, especially those in smaller and medium-sized independent practice. And there are a number of smaller and medium-sized independent pharmacies around our country. Can you talk a little bit about what do those doctors and what do those pharmacists have in common?
Well, what they have in common, a lot of them, is the fact that they are independent. Now, that is something that is going by the wayside. Did you know that the largest employer of physicians in America now is United Healthcare? United Insurance. I mean, the insurance company, they employ over 10% of all the physicians in America. United does. And again, we just, as we just had the cyber attack on Chance, and that was a big problem on Change, excuse me, and that was a big problem. And there's an example of where the giant corporations, as United has turned out to be, and the vertical integration that exists in there, I don't think serves medicine well. One of the first things I did when I got to Congress 10 years ago was to go to the FTC and ask them to look at that vertical integration that I described earlier. Finally, about 20 months ago, the FTC is now finally undertaking a study that's called a 6B study, that they're looking at the impact of PBMs on independent retail pharmacies. And that's something that is very, very important. And they've told us, whereas it may take anywhere from 2 to 5 years for them to come up with the final report, that as they go through this exercise, as they see it and identify egregious practices, they're going to go ahead and address them. I think it's very interesting to note that they have already retracted some positive statements that they have made in the past about the benefits of PBMs and have said that's no longer the case. They're not beneficial to patients.
As a pharmacist, primary care physicians sometimes view expanded scope of practice for pharmacists as a form of competition that might hurt their business. How would you address that concern?
Well, I certainly understand that concern. I think it's somewhat unwarranted. Look, the physicians are the quarterback. They are the captains of our team. We all understand that, whether you're a pharmacist, whether you're a PA or whatever, an LPN. We all understand that the physician is the captain, that they're the ones in charge of the healthcare team. We want to assist, and we certainly don't want to replace. Now, I will tell you that I am a strong proponent of expanding to the full extent and allowing pharmacists to practice to the full extent of their license. Now, we're not diagnosticians. I mean, I'm not trained to diagnose, a skin disease or an illness like that. That's not what we're trained to do, but we are trained in the way of therapy and of what drugs are going to work. And I just want us to be able to utilize our training to the full extent that we can. And I think that's the only way we're ever going to be able to save healthcare costs, to cut healthcare costs. And as we suffer through the shortage of physicians, I think that's going to play a bigger role as well.
A few minutes ago, you described your experience as a pharmacist talking to people about what their drug prices would be, and then maybe having to see them make some difficult choices. By now, we've all heard about the effects of the cyber attack on Change Healthcare. What did you hear from your constituents about that?
Well, this was a disruption. There's no question about it. In fact, we had the CEO of Change Healthcare, of United Healthcare, I should say, before the Energy and Commerce Committee and the Oversight and Investigation Subcommittee of Energy and Commerce. And we had an opportunity to ask him questions during that hearing about, what they did in the way of trying to accommodate people and pharmacies. I thought it was interesting that one of the points that he made was, that they were able to get the pharmacies back up quickly. And I asked him to define quickly, and quickly was defined as within 2 weeks. Well, you go without your medication for 2 weeks, and that's a problem. So I think we have different definitions of quickly. But at the same time, that we all understand cyber attacks. I'm sure that United and Change would have preferred not have to go through this, but at the same time, we have to understand that this is what happens, and especially when you've got so many different providers who are depending on you. When they hit a system as big as Change Healthcare, as big as United, it's going to have a tremendous impact.
And if I may, I'll switch gears again a little bit slightly. For years, physicians and patients have complained about the prior authorization process. And the Improving Seniors Timely Access to Care Act would streamline some prior authorizations. It has widespread medical support and bipartisan political support. Why has that not passed in Congress yet?
Well, that's a good question. And let's face it now, the insurance companies have strong lobbyists. They spend a lot of money up here, and they have a strong influence up here, particularly on those people who don't necessarily have a medical background. They don't understand it like I understand it. You talk about prior approvals. When I still had my pharmacy, I had an employee who was totally dedicated, and that was her job, was taking care of prior approvals. And I mean, full time. It's a pretty busy drugstore. I had 3 stores, and they were all pretty busy. So, you would expect to have quite a few prior approvals, but at the same time, one employee dedicated to nothing but that's a big problem. That's why this legislation is very important, and that's why it needs to pass, because look, I will tell you that not only here, but all throughout our committee, the Energy and Commerce Committee, and everything that we deal with, whether it be permitting and the permitting process for communications, for broadband, or in healthcare, or whatever, we're setting shot clocks and telling the agencies, look, you got to have an answer by this point. We're trying to do the same thing with the prior approvals, is to tell the insurance companies, you got to respond in a timely manner. And we're going to put a shot clock on you.
Another, large scale program, Medicare Advantage, is growing in popularity, but there have been reports critical about Medicare Advantage plans, ranging from overcharging taxpayers to improper denial of care for patients to lack of transparency to regulators. There's a broad mix of opinions about what should be done with Medicare Advantage. What would you like to see?
Well, there's no question that Medicare Advantage needs to be updated. Some of their policies and their programs are out of date and antiquated and need to be updated. I would like to see us take a comprehensive look at reforming Medicare Advantage. I think it is it needs to have it needs to have a total review of what the original intentions and goals and purposes were, and how it is and if it is achieving those now. Because and it's not just Medicare Advantage. We need to be doing that with a number of different programs. There are so many government programs out there that have not been reauthorized. In fact, I was in a committee meeting this morning. We were talking about that so many different agencies, so many programs that in some cases have never been reauthorized, and they need to be. And this is an example of one that needs to be.
In February, a KFF poll found about 62% of adults hold a favorable opinion of the Affordable Care Act, known as Obamacare. About 37% hold an unfavorable view. You've been outspoken about your views of Obamacare. Can you talk a little bit about those views, and do you still support repealing Obamacare?
Well, I do support repealing Obamacare, but let's face it, we don't have votes. I mean, it's not going to happen now, and at least not in the makeup of this current Congress, and it'd have to be a significant change in the makeup of Congress for that to happen. So what we have to do is to make it the best we can, and that means reforms within Obamacare. Obviously, I was an independent provider, and that is very important to me, and that's what we need more of. I think that Obamacare from the beginning was flawed, and that's why I believe we need to repeal it and start all over. I'm not one who's in favor of a one-payer system. I think Obamacare is going to lead us to a one-payer system. We need competition. If we're ever going to bring healthcare prices down, we need competition.
Our main audience is primary care physicians. What would you like to say to them, or what would you like them to know?
Well, I appreciate you giving me the opportunity to answer that question, because it is extremely important. Keep in mind that Congress is a citizen legislature. I'm a pharmacist. We have a doctor's caucus. We've got a number of doctors. We've got a number of dentists, a thoracic surgeon, urologist, dermatologist, and that's great. But we also, in Congress, we have people who have no idea about healthcare. We've got new car salesmen. We've got we got farmers, we got preachers, we got way too many lawyers. We got it is a citizen legislature, and that's where advocacy comes in. That's where educating members of Congress comes in. Every day I have a member of Congress, come up to me and say, I didn't know you were a pharmacist. I had someone in my office the other day says, you got a letter that I need to get signed on to, and I'm going to have my staff call your staff to get on that letter. That's what we need. We need people out there advocating and sharing your experiences. Let them know what is impacting your practice. To think that the government and that policies don't have any effect on your practice at all is erroneous. It does. And I think most physicians understand that now. But we need them to be involved. Get to know your congressman, get to know your senator, get to know their staff, and be a resource for them. Invite them to your practice setting. Show them the value you bring to healthcare, because you do bring value to healthcare. Your patients depend on you. They need to understand that. And listen, I always say, if you're not at the table, you're on the menu. So you need to be up here at the table.
I like that expression. I'm going to remember that one. That's a good one. You know what? I'm keeping an eye on the clock. If I can squeeze in at least one more quick question.
Sure.
What's an area that you think has not necessarily, people aren't paying enough attention to? It hasn't gotten enough attention either from other lawmakers the press or the public in general? Is there an area that you would like to see more coverage of?
You're talking about in healthcare?
In healthcare writ large, exactly.
Yeah. I think two things. I wish I could make one, but two things. First of all, physician shortage. That's going to be a big problem in the future, and we need to understand that. But secondly, again, what I've been talking about the whole time, and that is the conglomeration, the giant corporations now that are taking over medicine, taking over healthcare in general. I don't see that as being good. I just, I'm an independent at heart, and I just don't see that serving us well in the future. That's why I tell people all the time, I'm voting for Teddy Roosevelt for president. He'll bust it up. He'll come in here and bust it up.
I'll tell you what, like I said, I want to respect your time. I know we're on a limited time here, but I hope we get a chance to talk in the future. I really enjoyed our conversation, and I think these themes are frankly going to resonate tremendously with our audience. So,
okay. Thank you very much.
Absolutely. Thank you for taking the time,
right.
and certainly have a good weekend.
Okay, thanks.
Thank you.
Again, that was Medical Economics Editor Richard Payerchin speaking to U.S. Representative Earl L. Buddy Carter of Georgia. My name's Keith Reynolds, and on behalf of the whole Medical Economics team, I'd like to thank you for listening and ask that you please subscribe to the show on Apple Podcasts and Spotify. Thank you.